Welcome. I'm going to talk a little bit about COVID and heart disease, and I have a few slides that I'm going to kind of present. And I'm going to share ultimately the silver lining in all of this, which I think that you'll probably take away more than anything else. So I'm a cardiologist and in practice 28 years here in Fremont, California. I'm going to give you an overview of what we have learned in this past year. It's been a very tough learning experience, let me tell you that. So can I have that next slide, please? And I can discuss further about, without ado, where we are with things. So as you can see on this slide, you'll see hypertension, diabetes, prior obesity, and coronary disease or prior coronary disease and congestive heart failure by history, historically, as precursors of someone who unfortunately does catch COVID, and these comorbidities, can be very devastating for these patients and people. So I want to kind of elaborate very broadly about how the COVID virus hits the heart and how these factors play into it, and sort of, generically explain you what happens to the heart. So if you think of somebody with one of those pre-existing conditions that I talked about, whether it be chronic heart failure or coronary disease in the past, or diabetes, or anything else like I talked about, including obesity, one of the things that does happen is that there's direct damage to the heart. And this occurs in multiple ways. Number one, inflammation of the heart. The virus itself, the SARS-CoV-2 virus, infects the heart, causes radical inflammation of the muscle of the heart, which is devastating in many, many people and irreversible in many others. There's also an increased oxygen demand and a decrease in oxygen supply to the heart, which indirectly leads to a form of heart damage and can actually be a precursor for heart attacks, primarily from thickening of the arterial wall and blood clot formation in the vulnerable artery, and then eventually leading to heart damage. And then the COVID virus also directly inflames the heart, disrupting the clotting system. It's called a coagulopathy, as we call it in medical terms, and can destroy the blood lining of the heart and cause severe heart damage, whether totally or segmentally. So as I mentioned, it could either directly invade the heart or it could inflame the heart. And those are really serious, both of them, because they can be long-lasting and devastating, something we term myocarditis. Myo means heart, carditis means inflammation of the heart muscle. And then the heart injury is measured by something we call troponin. It's an enzyme that in the bloodstream, when it leaks, it can be because of a multitude of medical factors. It doesn't go up in patients who have, or it is elevated in patients who have heart attacks, but it can also occur in patients who are under stress. For example, they've got the COVID pneumonia, which we talk about, or they've had a COVID-related, what we call a septic episode, or if they're hospitalized chronically, it can also increase the stretch of the heart muscle, and that can also cause the enzyme elevation. So we talked about these pre-existing conditions, but what does it do directly to the heart? So if you divide this up into 5 or 6 different segments, the virus will attack the heart, as I mentioned, directly, causing inflammation. That's called myocarditis. Or as I mentioned, myocardia is the heart, and then carditis is the inflammation. Or it can cause what we call arrhythmias, which is an electrical disturbance of the heart, because the heart is not only a plumbing organ, it's an electrical organ. And so there's an electrical disarray that happens in the heart, and it causes what we call ventricular and atrial ectopy. To simplify, it causes arrhythmias. That means heart can become electronically unstable, and that's an issue. That's a very big issue, and can ultimately result in either heart failure or damage or even sudden death, unfortunately. And then there's the element of severe cytokine storm, which I'm going to talk about in the next slide, which Dr. Fauci has talked about a lot in his presentations on CNN. And the cytokine storm can cause what we call shock to the heart, or it's called cardiogenic shock, which again, cardio is heart, genic shock, it originates from the heart and causes shock in the rest of the body. And then on the other side, you can have what's called the heart attacks or acute coronary syndromes leading to heart attacks or myocardial infarction. And lastly, as I mentioned, there can be a propensity for thrombosis, which means clotting of the vessels. So in many ways, it causes a lot of difficult problems, electrical, muscle, as well as damage to other organs. So this is what I was talking about. Inflammation to the heart coexists in patients who have pneumonia, and about 20% of these patients who have mild symptoms of COVID eventually can develop pneumonia, and it leads to a very serious problem. And then about a fourth of those will develop very severe critical disease that requires hospitalization and can end up in a catastrophe like death. And this is where I was talking about the COVID related cytokine storm. This can cause shock to multiple organs, and we found this in 5% of all hospitalized patients, roughly. And another point is that about half the patients across the globe, and this is a very important point to note, if you don't remember anything else tonight, remember this, about half the patients across the globe that have serious COVID-19 related illness, which is chronic, will cause permanent damage to the heart muscle. And this is sometimes irreversible, and you'll have this chronic sense of fatigue, tiredness, shortness of breath, and things like that persist. So beware that if one's got COVID and it has been a serious event, that you absolutely need to be in touch with one of your internists or cardiologists that can help you. And then further, there can be heart damage that is caused. And we've talked a little bit about the myocarditis, so I won't sort of belabor you on that. How we check this is with magnetic resonance imaging, which is a more sophisticated way to see how much degree of inflammation has occurred in the heart and long-standing. Or we can check it simply in the office space with checking what's called an echocardiogram of the heart, which we do routinely, where we can actually tell how the heart muscle is behaving over a period of time with or without medication. So the oxygen demand supply ratio gets disrupted with any kind of serious COVID-related problem. And this is what we've learned during the pandemic, that what happens to these 5% of people, there's 5% of people that are critical in the ICU. There's a constant drop and rise in blood pressure. These people stay unhealthy and some of them succumb, particularly with the comorbidities that I talked about. And then on the other side of the spectrum, there's heart damage, which can be resulting in heart attacks or increased blood clots that can be a serious problem that can block off the arteries of the coronaries. And we've seen a huge rise in this during the pandemic. And this is something that I will reemphasize over and over. And I think that Dr. Sharma will, specifically talk about Stanford's experience. And I will also tell you that in our Washington hospital experience, we've seen a lot of these blood clots in the hearts caused by patients who've had pre-existing COVID or comorbidity-related COVID infections. So let's just talk, again, this is about the number of patients that have the disease and the percentage of patients that have this disease that causes mortality, because ultimately it goes down to mortality. So if the virus causes systemic inflammation or it causes a direct infection, if there is cardiac injury, if there's definite cardiac injury, the mortality untreated, not treated, but untreated is 50%. So that's very serious. In the same way, stroke that is caused by this because of thickening of the blood vessel walls from the carotid, which is the neck arteries, into the brain, or just in the brain arteries itself, untreated, the mortality is 40%. That's very high. Of course, with treatment, this can be reduced by almost 90%. So that's very, very important. And then on the other side of things, the embolic risk, which is where the blood tends to clot, but also the clots tend to migrate, that mortality is very high, for example, into the lungs or into other body parts. And lastly, when COVID-related arrhythmias occur, if they are left untreated, it's almost about 1 in 2 patients end up with something really bad. So it's something to kind of be thinking about very seriously, especially in very sick hospitalized patients. This is not across the board, but this is particularly in patients that are hospitalized. So the take-home message is that COVID mild infections, they can still cause heart damage, but not cause catastrophe, obviously, but they can still be associated with blood clots. Moderate patients usually either end up in doctor's offices or end up in hospitals. And then severe patients end up in ICUs. So, and that's only 5% of the total patients. So keep that in mind. So what do you do? I mean, basically, don't doubt. The American Heart Association tells us that don't let yourself die of doubt. Basically, that's the message. Okay, so don't say, okay, if I have this, this could happen, if that could happen. If you have any doubt, just go ahead and call 911, especially if one has had, some sort of chest pain or heart problem, and there is underlying COVID, infection. If there's no COVID infection, even then, patients should take this very seriously and consider, getting to the nearest hospital as quickly as possible. And what studies have found is over the last year is that in the early pandemic days, this is a very important take-home point because we learned through this process ourselves. Heart attack visits to the emergency room fell by 1/4 and stroke risk by 20%. Why? Because people were just fearful. They did not want to go into the hospital. They were scared. In fact, the Harris poll from the AHA, that's the American Heart Association, found that almost 28% patients with symptoms of heart attack or stroke would rather stay home from fear of getting COVID at the hospital. That was such a bad myth. But we learned as we went through the pandemic that, the ERs are safe, the hospitals are safe, they're taking their PPE precautions, they're making sure that people are kept safe, they're keeping the COVID patients away from the non-COVID patients, they check, they screen. So these are things that you have to be aware of. Don't be afraid. If you have a serious chest pain, anywhere more than 5, 10, 15, specifically 30 minutes, you have to get to the emergency room. The sooner is better. Time is muscle. That's the message. So these are things that, again, these are factors that have come through that I want to kind of belabor to you during the time of the COVID episode. 36% patients during this peak of COVID, suffered from COVID-related trauma. So they would just basically not show up at the hospital or would show up at the hospital late. And more than 23% were worried about a heart attack and 22% were worried about panic from stroke. So it just wouldn't show up on time. And then cardiologists also, like myself, we surveyed people that if they didn't have primary care physicians, they would basically avoid going to the hospital. So having a primary care physician is really a good thing to have because they can educate the patient well enough to get to the hospital as quickly as possible when in doubt. So that's very important. That's why you always have to call your doctor as soon as you know that there's something bad going to happen, or call 911 if it's very serious. And again, this is another issue in the Hispanic community and the African American community. About half the patients were fearful and would just stay home rather than go to the hospital. That was very, very sad. But unfortunately, some of those patients succumbed just staying at home, the elderly and so on and so forth. Now we've taken some of that fear off thanks to media, thanks to education, thanks to discussions with clinicians, thanks to our ERs being, better controlled and better equipped with COVID precautions and so on and so forth. And as I mentioned, if you have chest pain or severe shortness of breath, call your primary care physician, show up in the ER. Don't wait for your cardiologist to call. If you have a cardiologist, you can get to see quickly. Just show up at the ER. You'll find somebody who'll take care of you over there. Last slide, please. I think I have one more slide to kind of share with you about this whole silver lining, as I said. So if you think about how we can avoid it, I mean, basically we've talked about the good news of vaccinations. Thank goodness vaccinations are coming into play. California is ahead of the game, and I'm sure that you'll hear more from other speakers and from Rahul about what vaccines can do and how much they've helped. But basically, changes behaviors and changes the way we show up and maintaining our lifestyle, going out and so on and so forth. And kudos to the fact that we're moving fast with the vaccines. But generally adopting healthy behaviors, keeping social distancing, maintaining masks when you're not, when you're in conjunction with other people. Those are important things. Making sure your diet is healthy, making sure you're on a good Mediterranean diet. That's important to prevent anything serious from a cardiovascular catastrophe. Making sure you eat generally home-cooked foods, walk outside, get fresh air, while the gyms are still closed. I think they're finally opening up. I hear it's about 25% gym capacity now in certain counties. And then again, make sure that you keep a blood pressure monitor with you at all times, keep a sat meter or saturation meter with you at all times, regardless of whether COVID is the pandemic or not. I think it's important to do that. And then lastly, keep the CDC guidelines in your head all the time so that you're very sensitive to other people. So I think that's the message that I want to kind of convey today about how an ounce of prevention is better than a pound of cure. We don't want to see the bad side of things in hospital settings. I thank you for your attention.